Tinker Balisa from BSN1A. So today I'm going to do the assessment of female and male genitalia and inguinal area. Today, sir, I am Tinker Balisa, your nurse for today, and I was asked to do assessment on your genital area and inguinal area. So can you just state your name and age?
Ryan Casey Ramos, 18 years old.
Okay, so it is essential and necessary for you to assess your genital area and inguinal area to assess if there are any problems on it, okay? So before that, I'm just going to wash my hands and provide for privacy. So before we start the assessment, I'm just going to ask some history of yourself, okay? So kapag ba umiihi ka, masakit po ba?
Hindi naman.
So kapag gabi po, frequent po ba yung pag-ihi nyo or madalas yun?
Hindi naman.
Okay, so is there any abdominal pain kapag umiihi ka?
No.
Okay, is there any swelling na nakakapa mo like bulges or bukol?
Wala mo.
So does your family have nephritis, malignancy of prostate, or malignancy of the kidney?
No.
Okay, good. For the assessment, I'm going to start for the pubic hair. So inspect the distribution, amount, and the characteristic of the pubic hair. For men, must be in a diamond shape or diamond-like, okay? And observe for the nits, lice, and rashes on the hair, okay? Then next, for the penis, inspect the penile shaft and glands, penis for lesion, nodule swelling, and inflammation, okay? So we're just going to use our eyes, and you should not touch it because it's just inspection, okay? For the next, inspect the uteral meatus for swelling, inflammation, and discharge. So the normal location of the uteral meatus should be at the center. So if you can find it, ask the client if saan siya umiihi or saan lumalabas yung ihi niya. Then, compress or ask the client to compress the glands slightly to open the uteral meatus to inspect for its discharge. If the client to strip the penis from the base to the uterus. So, okay, as I can see, there's no discharge from there. And next, palpate the penis for tenderness, thickening, and nodules using your thumb and first two fingers. So usually, you can also use this your thumb and index finger, okay? Palpate slowly from the base, going to the shaft and going to the meatus, okay? From here, palpate slowly from the base, going to the shaft and going to the meatus, okay? This is the meatus and the tip of the meatus. This is the tip of the meatus. So, what I'm going to do is I'm going to squeeze the meatus and look if there is a discharge coming out from it, okay? As I can see, there is no discharge from the meatus. So, if there is any discharge, you should document your findings, including the color, consistency, and the smell of it. Okay, last, I'm going to assess the scrotum. First, I'm going to inspect the scrotum for appearance, general size, and symmetry. So, this is the scrotum. This two. So, I'm going to you can ask your patient to hold up the penis so that we can observe properly the scrotum, okay? So, inspect the appearance, the size. So, the left side is quite lower than the right side, which is normal. So, kapag naman sobrang malaki yung isa from the other, there is a possibility may problem doon. Then, next, to facilitate inspection of the scrotum, during the physical examination, ask the client to hold the penis out of the way, okay? You can ask your client to hold it up. Then next, I'm going to inspect all the skin surface by spreading the rugated surface skin and lifting the scrotum as needed to observe the posterior surface, okay? I'm going to spread the wrinkled scrotum skin and separate the skin and lift the skin scrotum if needed to observe the posterior portion, okay? This is the scrotum. Then next, lastly, I'm going to palpate the scrotum to assess status of underlying testes, epididymis, and spermatic cord. I'm going to palpate both testes simultaneously for comparative purpose, okay? But usually, you can use or do it one by one so we can observe it properly. What I'm going to do is to follow the passage way of the sperm. Okay, from here, lower, the testes, the epididymis, and the okay, from here, the epididymis, and going up to the spermatic cord. and up, okay? Slowly because sometimes it can be painful for the patient. After doing your the other side, do it on the other side. Here, testes, epididymis, and the spermatic cord, and up here. This direction to here, from there to up here, okay? Then, document the findings. After doing the assessment of the male genitalia and inguinal area, I've done doing inspection and palpation. I can conclude that there is no ulceration, inflammation, and any kind of problems.